Right. Today also we are going to discuss about the middle cerebral artery. While talking about this middle cerebral artery, is most important to the some form of stroke patient who are having some form of damage inside the brain, middle cerebral arterial supply. Due to this damage, we can categorize the patient some form of point wisely, some form of damage wisely, some form of duration recovery, the prognosis duration wisely. How the middle cerebral arterial damage patient recover, and what are the difficulties area. Today we are going to emphasize some form of categorizing the middle cerebral arterial damage stroke patient 1 to 10, the first patient and second patient, third patient, fourth patient, fifth, likewise the 10 patient. This arterial damage patient who are having what are the area, sensory area, what are the motor area, what are the speech area, what are the spatial area, what are the visual, what are the area affected area. Likewise, we can categorize the 1 to 10. Likewise, this middle cerebral arterial damage, some form of normal, the visual, and their affected situation. These things we can gather some form of experience and our experience using this categorized method. First patient is also the middle cerebral arterial damage person. This is the brain area. This picture is normal pictures. This is the hand. This is the leg. The dominant area, we know the dominant area, right arm, left side brain damage. Due to left side brain damage, the first patient, we are going to talk the first patient. This patient is happening to be damage of the brain, but he is normal. It's not a little bit damage, it's some form of large damage or some form of TI likewise damage, but that damage not to affect his whole body. Arm is okay, that's the arm. Arm is okay. This is the arm. Arm okay. Leg okay. He can walk. He can do in the ATL. Sometimes he can't feed. This is the problem. Feed, self-feeding is the effect on hand. But he can walk. Walk also the good. Walk also the good. Uh, feed, affect. Feeding is the question. Walk is the good. Feeding is the affect. The coordination movement. Coordination movement also the affect. Some form of sensory numbness or more pain, severe pain of the arm and face and leg. But he can walk, he can do some form of activity. Sometimes he can't write. That's another problem. He can't write. He can't write. But his leg and arm range of movement, arm range of movement is good. He can balance walk. He can do an aerial dressing like toilet and washing, and feeding is the effect. Combing also the can. But his arm is strength. Strength also the reduce. Strength. Strength also reduce. Leg is strength also the reduce. Leg is strength reduce. Arm is strength reduce. Writing. Sometimes he can a little bit writing. Coordination also the good. Small finer coordination is the effect. Feeding also the large eating food he can eat and he can drink, but the mixing and feeding is the effect. Visual also sometimes the visual field also little bit visual field also the effect. Speech and swallowing also the question. This person is the first person. He can walk, ambulation is good. He can do in AD a lot of speech is the slurry speech, and fluency of speech is not fluent, but he can speech. The memory also the good, expression and comprehensive speech also the good. Is the normal person, but we have to gain some form of thing. This person is the middle cerebral arterial damage patient, but he is the first categorized first person. He can walk, leg also the good, hand have also the good, trunk also the good, head and neck control also the good. He is not a bed bound, but